Welcome to the podcast. I'm Tracy Donegan. In today's episode, we're diving deep into the amazing world of photobiomodulation for midwives, a cutting-edge therapy that is transforming women's health. Did you know that a staggering number of women suffer from metabolic dysfunction, impacting their pregnancy, birth, and postpartum? The science behind photobiomodulation, also known as red light therapy, offers a simple and powerful solution. This therapy works at the cellular level to boost mitochondrial functioning, one of the root causes of many pregnancy complications. Join me as I explore the latest research and share how midwives can integrate this innovative therapy into their practice to support and empower women through every stage of their journey. And now I bring you photobiomodulation for midwives.
Thank you, Portia. And thanks to everybody who has made, this last 24 hours such a success. For all of your dedication. So I want to talk to you today a little bit about light therapy for midwives. And it's an area that really kind of piqued my interest about a year ago. And when I started learning about it, it struck me as one of these snake oil, does everything kind of therapies. And as I'm sure we've all learned over the years, that when you come across a therapy that says it can do everything, that we really shouldn't trust it. So I've just kind of, been proven wrong time and time again. Every time I do think is this a panacea, and can it do so much? It's not that it does so many things. It does one thing really well, and that's what we're going to talk a little bit about today, about our cellular metabolism. I'm going to take you back to your biochemistry classes. Hopefully that won't be traumatic for any of you. It was for me when I was learning about this first. So Portia, we can go to the first slide, please. So quickly, we're going to look at understanding what photobiomodulation, or PBM, is. Some of the early discoveries that led us to today's massive amount of research in this area. The evolution of PBM in medicine, and where I want to see it go in midwifery, how it works at a cellular level, the safety of PBM in pregnancy, using it as analgesics in labor and postpartum and for recovery, and then looking ahead, what's kind of coming up in the research and ways we can apply PBM to other parts of women's health. Next slide, Portia. So just for a moment, I want you to just think back to, imagine the response if you were a midwife maybe, 50 or 60 years ago, and the idea of water birth was emerging, and how foreign a concept it seemed, and the idea of why would we put women in warm water for labor, and the fears around that babies would drown and labor would be so much longer. So kind of think back to how you might have responded if you were around in those days when water birth was just kind of becoming recognized, or back in the 1950s when Nurse Ward in the UK discovered that she would take babies with jaundice outside, and like many of us, the belief in fresh air and a bit of sunshine does do the world of good, and she would take those babies out into the sunshine, and without not with hospital approval, and then bringing them back in, and the doctor saying, oh, there were parts of the baby's body that were still looking a little jaundiced, and those were the areas where the sun hadn't had contact with the skin. So now we're at a point where blue light for jaundice is something we don't have to think about. Same with TENS machines. When TENS machines came out years ago, the idea, and actually still today, I think, for some moms, the idea of putting an electrical stimulus on your back and how that could make labor easier is still a step too far for some moms, but we know there is some good science behind it. So as I continue on this afternoon here in Texas, I'd like you to suspend your skepticism, really, suspend your disbelief of what we're going to discuss, and just think of where this can go in the next couple of years to support women and babies. And I think of it now as like it, you know, as midwives, we're always talking about, you know, if you have a bruise or a bump or a cut, you know, put a little breast milk on it, and breast milk kind of cures everything. Well, I feel the same way about photobiomodulation and how applying it to this light form to the body can really have significant and really profound effects on our health. Next slide, Portia. So photobiomodulation, it's known under a couple of different names. So photo, meaning light. So these are packets of light that are being absorbed into specific chromophores or cells that accept these light packets. So photo meaning light, bio, the living cells, and modulation being the influence. So we are changing what's happening in these cells. And one of the reasons why it's so difficult to track down the research, specifically on pregnancy and the use of PBM, is it's also been known as cold laser, red light therapy, LLLT. So when you're searching the research, you have to use, there's more keywords than the photobiomodulation that you'll need to use. But the scientists agreed, I think it was about 2018, that photobiomodulation was going to be the scientific term that was agreed upon that would be used in future research. Next slide. So photobiomodulation, it's a form of light therapy that uses non-harmful, so we're not using UV rays, non-thermal, so this does not heat up the skin the way a heat lamp would, of light through the eyes, which through the eyes we're going directly into parts of the brain, and then to the skin to activate healthy physiologic responses from the cells in the body to increase cellular energy. And that's really the key here. We're helping our cells, specifically our mitochondria in our cells, to work more efficiently and to get them back into a state of homeostasis, to reduce pain and inflammation. So the process itself involves these specific light sensitive chromophores or light acceptors that we have in the mitochondria that elicit this physiologic response from the cells when they're activated by specific wavelengths. And these are wavelengths that are found in the sunlight when we're outside. Next slide. So if we think of light as an essential nutrient, and unfortunately, most of us are, in fact, light deficient, and our bodies are starved for light. We spend, I think it's estimated, around 95% of our time indoors. So not only are we missing out on, and we know that already there are concerns around vitamin D levels in pregnancy, and most of us being deficient. But when we look at spending 95% of our time indoors, we're indoors under artificial light. So there is, and there is a wealth of evidence showing how artificial light can be harmful to all of us when we are not getting any of that direct sunlight. So artificial light does come with risks that we are well aware of. And next slide, Portia. So just a little about the beginning of where it all started. So back in, I think it was the 1960s, Professor Mester was, he was playing around with what's known as the ruby laser, and wanted to see if by implanting cancer cells into rats, could he either make the cancer grow by applying this laser to it, or could they destroy the cancer cells? So he didn't actually, his theories didn't prove out at all. But what he noticed was on the areas that the laser was used, the wounds healed much faster and the hair grew back significantly faster in those areas. So when he then realized that the laser he was using was actually not as powerful as the original ruby laser. So this was where it started, this low level laser therapy. And then we move on to, years later, then we see NASA doing experiments in space, looking at wound healing and the idea, how does being in a non-gravity, how does that affect wound healing and bone density? So NASA came out with these studies, but they weren't using lasers. NASA were using LEDs. And these are similar to the LEDs that we see, we have in our homes. So something that is, again, not dangerous. And when we're using a specific wavelength, we can really change what our body is doing and the cells within that. So these days, Professor Michael Hamblin, who's based in the UK, is the authority on PBM and has been cited in, I think the citations are something like between 40 and 60,000 times. And a lot of his work these days is on using PBM for traumatic brain injury and Alzheimer's and Parkinson's disease. So it's really an exciting time to be alive when this therapy that has been around for quite a while is really now starting to make it to mainstream. So next slide. So the current use of PBM, this is what we're seeing now. So we are already very familiar with blue light for jaundice, acute and chronic pain. So we're seeing it used now by dentists and pediatrics. So specifically they can use these lasers as analgesic. So for any of you who have kids that are really scared of the dentist, we can use this laser and get good analgesia for that procedure. We have accelerated wound healing and improved scar remodeling, good research on fibromyalgia, burns, bone fractures, stroke, as I mentioned, traumatic brain injury, age-related macular degeneration, arthritis, and then skin care. So you might have seen some of these pop up on if you're on Amazon, because there's so much focus on red light for skin care as an anti-aging product. So this is kind of where the research it's kind of diverged off. We have the clinical research, which is focused on using the treatments for, again, clinical care, and then we have this kind of offshoot, which is more around kind of the bro science for using it for exercise recovery and muscle building and kind of weight loss, which is all very well and great. But for me, I'm just really interested in how we can apply this therapy for mothers today, especially during pregnancy. Go ahead, Portia. So when we look at this is kind of what I mentioned earlier on. Like when you see a list of the medical indications that have been studied already using PBM, you look at it and there's hair loss, and then there's like wound healing, periodontitis, pleurisy. It just seems to be like, is there anything that it can't help? And I haven't found anything yet that it hasn't had a positive impact on. So it is, I think, I have to sit down with a group of midwives and let's just come up with a list of what are the big issues that women are faced in pregnancy at the moment, and how can we, start to use these therapies to help them have reduced pain, improved quality of life, and increase their wellness during pregnancy. Go ahead, Portia. So the research is growing, and I want to thank James Carroll from the Novathor, he's a researcher and also is, his company produced these, they look like tanning beds and there's been like so many trials now that we can't in midwifery ignore this anymore. So huge amounts of trials that are ongoing. And if you look in the NIH database, you can see like funding for more upcoming trials. And there is several more for pregnancy that's going to be hopefully published soon. Go ahead, Portia. So what does the evidence base look like? So there is strong evidence for musculoskeletal pain, oral mucositis, which I'll talk about in just a moment, and strength and recovery after physical strain, and that dry age-related macular degeneration. Sorry, my teeth are falling out here. But I just want to, before I look at the moderate evidence, for musculoskeletal pain, we all, I'm sure, know somebody who is suffering with moms that we're looking after that have pelvic girdle pain or carpal tunnel syndrome, backache, just all of, some of the kind of, complications of pregnancy that can really affect a mother's quality of life. So I presented a kind of a longer session at the Mama conference in Scotland there recently. And just, I'm not associated with Mama in any way, but I think as midwives, if you can get to the Mama conference in Scotland next year, it is really a phenomenal community of midwives getting together and sharing information, and lots of oxytocin. So, but I'm sure, like many of you, there were midwives sitting in the audience listening to me speak, and with a skeptical eye of how can it do all of these things. And there was one midwife in particular that emailed me a couple of days after the conference to say that when I was, again, how skeptical she was, and her daughter was experiencing severe PGP and was on heavy medication, codeine, opioids, and was on crutches, and really debilitated for her the last couple of weeks of her pregnancy. So the midwife went online, just randomly bought a one of the light belts that you can pick up on Amazon, and decided to give it a shot. So within literally 3 days, her daughter has seen a significant improvement in pain management. So she's been able to reduce her NSAIDs. Her movement is better. She is, is finding it easier to get up the stairs. So for me, when I hear these stories, it's like, we have to be talking about this. We have to be talking to every midwife out there about how we can apply this therapy to pregnancy and postpartum recovery. So then moderate evidence, lymphedema, wound healing. There's some really nice papers out there looking at cesarean wound healing, specifically for, again, for analgesic and for healing the actual wound itself more quickly. Then neuropathic pain, fibromyalgia, orthodontics, cognition, and then we're into the experimental trials that we're seeing now. So go ahead, Portia. So very recently, the NHS in the UK has adopted PBM for oral mucositis. So for anyone who is unfamiliar with what mucositis is, they have brought it in now as a treatment before they start cancer treatment and during cancer treatments. So for someone who is experiencing oral mucositis, what happens is they end up with really painful mouth ulcers. So in the mouth and in their throat, which means when you are, about to go through cancer therapy, or you are in the midst of cancer therapy, your desire to eat is really, really blunted, because who wants to eat when it's so painful? So what they are doing now, and if you go and Google photobiomodulation and oral mucositis, you're going to see these. There's some brilliant videos of like 4-year-olds sitting with this, what looks like a lollipop, big lollipop, and kind of, put it into their mouth. So they are able to self-treat in the hospital, and then they put it on their outside, on their cheeks as well. And they're finding like significant improvement in this oral mucositis. So again, quality of life for these people that are dealing with like a really serious illness and the complications that come along with that cancer treatment. Go ahead. So if we think of mitochondria, and again, this is the bit that might be a little triggery for some, as it was for me, trying to get back into the biochemistry. So if you might remember mitochondria being, the power plants, so the little batteries of every cell in the body. So as long as our mitochondria is working really well, it takes the food, turns it into energy, known as ATP, so that it can, our cells work well, so our bodies work better, and we reduce inflammation. But when through aging and injury and stress, what happens is the mitochondria themselves become stressed. And when they become stressed, they release free radicals. And free radicals then are one of the core aspects of inflammation in the body. So more free radicals means more cellular damage and more cell death. So what we're trying to do with this, literally shining this light onto the skin, is to energize those mitochondria so they can do their job more effectively. Next slide. So we're talking about this, I like this term, a cascade of light, because we're all very familiar with the cascade of intervention, but this is a really positive cascade. So these light receptors, again, these chromophores in our cells that cause the ATP to increase. So cells have more energy then for all of the functions of the body. The oxygen then it displaces nitric oxide. And if any of you remember Krebs cycle, learning about this cycle of cell metabolism, it's quite an intricate and detailed, I guess, description of how it works. I'm not going to go into today. It's because we don't really need to know it right now. And that displacement causes an overproduction of harmful reactive oxygen species, those free radicals, and it causes DNA damage. So when we have healthy levels of nitric oxide, that increases vasodilation and accelerates the inflammation process. So accelerating, not interrupting it, and decreasing pain. So then we have wound healing time then being significantly accelerated. And this is the leading hypothesis. I think researchers are still trying to figure out now, what is this actually what's happening? But we seem to have narrowed it down to these mitochondria. And mitochondria are present in hundreds and thousands in every cell in the body. And for areas that like the brain, reproductive, like the ovum, would have something between 200,000 to 600,000. So anywhere that we need a lot of cellular energy, heart tissue, you will see that there's a lot more mitochondria in those tissues. Go ahead. So when the mitochondria is dysfunctional, we have trouble, basically. And it turns on this master switch for more inflammation in the body. And that's known as NF-κB, nuclear factor kappa B. Inflammation increases cell death, aging, degenerative diseases. So think of red light therapy or PBM as regenerative medicine, because we are seeing it not just improves wound healing, but it is causing angiogenesis, DNA changes. So if we can help those ATP and get more energy into the mitochondria, that master switch then turns, it's like a double-edged sword. It turns on for repair and regeneration by reducing inflammation, increases circulation around the body, then reducing pain, and increases stem cells for different areas of the body. Go ahead, next one. So there are other ways that we can stimulate this ATP within the cells. So for anyone who is a fan of intermittent fasting, we know that supports mitochondrial functioning. High intensity exercise does the same thing, and of course sunlight. But these all usually, especially with exercise and fasting, they all take time to have an impact on our mitochondria. Whereas we know that with PBM, sometimes the effect can be almost immediate. As I shared with you that example from the midwife's daughter in the UK, having that experience within 3 days, able to significantly reduce her significant reduction in pain management medication. So the analgesic effects can be immediate. Personally, I have found with working with myself is, again, it depends on the tool you're using. 15 to 20 minutes. If I've turned an ankle out running today, I can sit with my literally a light pad that wraps around my foot, and 20 minutes. I'll do it kind of a couple times a day, and I feel pretty good pretty quickly. Go ahead, Portia. So we know that pregnancy and participating in endurance effects require a significant metabolic increase. And in pregnancy, we have huge adaptations taking part. And we know that most women are not entering into pregnancy in a really healthy, well state. So applying light to the women who are dealing with, again, a lot of the musculoskeletal problems, and something that I have a really strong interest in is using this for metabolic disorders such as preeclampsia. I think there is huge potential for us to maybe prevent preeclampsia right from the beginning of pregnancy. Go ahead, next slide. So when we talk about this, is quite an interesting aspect of this therapy. So if you go out and you look at some of the main manufacturers of PBM products, pretty much everything says do not use in pregnancy, do not use in pregnancy. Or, I've had discussions with other researchers saying, oh, there isn't any research. But as I mentioned earlier, you have to really dig in to find that research. And there actually is plenty of studies out there that have shown no side effects. So if we're comparing, a woman that is, third trimester dealing with pelvic girdle pain, which is, so common, and she is now taking ibuprofen or other NSAIDs, we know that has a risk, that there's risks associated with that on mom's system and on her babies. So we can see here just a couple of examples of evidence for using it safely, and a couple of systematic reviews that are saying, yeah, this is actually not dangerous for women at all. Next slide. So there have not been any trials on using PBM on the bump itself. So women who have participated in trials previously, it's usually the belt is used, especially for labor and back pain. Then we're using the belt on the lower back, not on the bump. But I want to tell you about a really interesting research that was done a couple of years ago, an Australian piece of research. And it was trying to, they had looked at using PBM to reduce retinopathy of prematurity in animal studies, and it seemed to work really well. So they did a trial, and then this was the larger trial that they did using light therapy. And usually, like, the baby is in their isolette, and they have the light therapy just really over their head. So they're getting kind of almost like a full body experience of the red light. So what they found was, and these babies were like 27 weeks. So these babies were very ill babies, and they did the therapy daily until they were, I think it was 34 weeks. They didn't, based on the protocol that they used, they didn't find that it improved this, but there were no adverse reactions. However, and again, it didn't reach statistical significance, all of the babies in the PBM group survived. So we have, and I think, if I was a mom, I would be thinking, if I had a premature baby, knowing this research, I would be asking for it, because like that's 5 babies that were lost. And again, we need more research in this area, but it's definitely something that again, we might be able to help the most vulnerable in our care, those premature babies. Next. So I think one of the questions we need to be asking when I do get this question about the risk of red light. So again, this is red light and near infrared that we are exposed to when we're sitting out in the sunlight, when we don't have 10 inches of sunscreen on us and all of our clothes on as well. So there are, again, plenty of research out there showing the impact, significant impact on health of shift work. And as midwives, I think we are particularly at risk for, again, not being, we have abused our circadian rhythm, really, and we're now only seeing what's coming out in the research of how this affects our health, our hormones. There's every aspect of our mind and body that is affected when we are out of sync with our circadian rhythm and our exposure to light. So there's been some interesting studies. Higher blue light exposure in pregnancy is associated with higher fasting glucose and infant birth weight. So women who are sitting on their phones at nighttime, for a couple of hours watching TV or sitting in front of an iPad, we really need to discourage that. And as some of you are very aware of how melatonin and oxytocin work so well together. Another study then, pre-sleep light exposure linked to gestational diabetes. And then this last trial was in China, and it was association between exposure to outdoor artificial light, so just street lighting, in early pregnancy at night and the risk of preterm birth. So I really feel like we have not even scratched the surface of the risks of artificial light in pregnancy. And I remember talking to Michelle O'Donnell years ago about this idea of using blue light as a way to slow or prevent preterm labor. And there's been some really interesting experiments done with women who are in prodromal labor, where it was at nighttime. So we have high melatonin levels, oxytocin is building, and they would wake the women up and put on a CTG and watch the labor pattern, and they could see that how the pattern of surges got longer. So we had definitely an impact on labor patterns as well. And we all know, we talk to women about, sometimes when you go into hospital, that because of the stress and the moving from home to hospital can slow your labor. I'm thinking, yes, stress is one part of it, but we really need to have these moms walking in, not wearing sunglasses, but wearing blue blockers to prevent the fluorescent light from affecting their labor. Go ahead, Portia. So some of the contraindications that we've kind of seen so far. So again, not to be used over the abdomen in pregnancy or during the first trimester. However, what they're seeing in animal studies, and I know that we can't always extrapolate animal studies into humans trials, but what we're seeing in the animal studies is that it is supportive and have positive impact on early development. We always want moms to talk to their providers about using PBM, and that's really to do with the increased circulation, and cellular health may change your dosage requirements. So talking to, again, the more midwives know and the more we can share with our obstetric colleagues as well, it's really, really important. And then being careful with photosensitive medications, light sensitive antibiotics, and we don't want to use it on wet skin, really, because it's it will reflect off the skin. But we do not see any issues with LEDs and burns or discomfort at all. No side effects registered really in the studies on pregnancy. Go ahead, Portia. So as an analgesic, what is the mechanism of action? So first of all, it increases blood circulation. So we are bringing in all of these great endorphins. We're bringing lots of good blood flow to the area, especially in those early stages of, like, maybe after a cesarean birth. The inflammation process is accelerated and completed. So NSAIDs interrupt the inflammation process, whereas PBM will accelerate it to completion. Stimulates cellular repair, we have endorphin release, and then it almost acts as a block for those signals that are traveling to the brain. Next slide. So there's been a couple of labor pain studies, and one of the first one was a trial that was done in Iran, and it was on first-time moms and comparing it to a hot water bottle. And what they found was significantly reduced pain perception and shorter labors as well. So, which I think we can make sense if we have increased circulation, an analgesic response. We have moms that can be up and mobile and moving. Then the second study then was a study from Brazil, and that was comparing it to using PBM and these we're only using it for like 20 minutes, and that was 20 minutes, I think, twice during the labor. This randomized control trial did include multips as well, so not a great trial, but still really interesting to read about the experiences using, again, these very simple tools on the lower back during labor. And then there has been multiple papers on pain reduction for painful periods. There's some nice studies on endometriosis as well. So for, again, abdominal pain, musculoskeletal pain, and we know that as women, abdominal pain just is rarely taken seriously. So here's a tool that women can use for themselves if they haven't found satisfactory care with their provider. Go ahead. So some of the applications for postpartum recovery: reduction in analgesic requests after cesarean birth. And this is published research. Accelerated wound healing after a cesarean, perineal injury, for nipple pain. We haven't looked at breastfeeding after pains yet, but I would put money on it that it will work really, really well. Lower back pain, vaginal dryness. So this could be, connected with breastfeeding, but also I think there may be anyone watching here today who's menopausal may find the red light therapy to be really helpful for you as well. Postpartum depletion. So when you're a mom who's kind of, when you're a new mom, you're in a state of acute inflammation. So anything that we can do to give our cells a boost for, more energy ourselves, for more and less brain fog, I think has to be a good thing for postpartum for these moms. Couple of studies on mental health, and the mastitis study hasn't been, it has been done on, I think, in dairy farms, which will tell you how important breastfeeding is to the world. But we haven't seen any mastitis yet. So maybe there's somebody watching today that would like to take up that challenge, and let's have a look at some new research on mastitis. Go ahead, Portia. So this is an area that I think there is huge potential, and I'm again hoping that somebody will watch this and realize that yes, there is definitely something we can do here. So preeclampsia being again one of the few fatal complications of pregnancy in the developed world. There is no cure really, and it often requires labor induction, which of course there's risks there as well. So it is largely being associated with free radicals produced by the placenta. And oxidative stress seems to be the central component of both the placental and endothelial function. So for me, I think this is somewhere that I would love to see somebody jump on this bandwagon and let's do some studies, and because this could be really life-changing, life-saving research. Go ahead, Portia. So in summary, this is really one of the most exciting aspects of, and the fastest growing aspects of medicine today. It has been underutilized in pregnancy so far. I think we can really do a lot of good by learning more about using PBM within our own services. For anyone who is involved in kind of, the biohacking community, what you'll find is they're already using red light therapy in pregnancy. They have been using it for a couple of years now, but we're just learning about it now. So moms are already off using it. So it's really important that we can answer their questions and help them use it really in an optimal way. So I hope that was kind of a whistle-stop tour of PBM. Hope that was interesting, and hopefully you'll go use it.